Hey guys, I'm Sebastian. I'm going to talk about some aspects of lower back pain with sex today. I know it's a little bit of a taboo conversation, especially in America, but the fact of the matter is a lot of times people will have back pain when they're having sex or when they're experiencing acute exacerbations of their back pain that they're dealing with for years. And so there's been a lot of research over the years, or at least enough research over the years, to give us a lot of information about how we can coach someone into having a normal sex life and not robbing them out of the relationship building that happens with sex just because they're dealing with back pain. And this can go with men or women. By the way, I'm only going to cover a couple things today because there are a lot of circumstances why people are having back pain and their mechanics will change a little bit. So I did write a massive article and I drew some pictures and all that stuff. It's in the link description below, and so please read that in detail because I spent a lot of time on it and it's going to be very helpful to you. It helps categorize things into a little bit more specifics. If you are looking for help, though, we can help you. We're in Costa Mesa, California, and we see people all the time with this. All right. So the first things first is that your spine, your lower back here, typically there's something generating pain. There's a structure generating pain. Sometimes, not all the time, but we can also use the general terminology what we call flexion or extension intolerant. All right. Flexion intolerant is bending, this is the back side of us, this is bending forward intolerant, such as so. This might create some back pain and referral into the glute, into the hamstring, into the calf, and so on. Extension intolerant is bending backwards would be painful. I feel a little pinching pain right up into here on me when I bend backwards, and so I have a little bit of extension intolerance happening, which we can classify as things like your facets and all that kind of stuff. But really, the body, think of it more in general movements, because when we're talking about lower back pain with sex, a lot of times we're talking about which movements you're tolerant of, because the positions are important because they generally migrate towards one end of the spectrum. All right. Now, flexion intolerant types of positions are ones that are going to be having your rounded. You're rounded. A lot of times reaching is a more rounded position. Spooning is a more rounded position. I guess I should talk about, men in this scenario because it changes from men to women. And so men in this position, the spooning is not going to necessarily work. Usually there's an exercise we have called the stallion, all right? And it makes sense why, because it's called the stallion, all right? You hold a kettlebell up here. We hold a kettlebell up here, and we're having them just straighten out their hips. So it's a more hip hingy movement. This is why things like exercises like deadlifting and barbell hip thrusting and stallions are helpful to train people to use their hips with something like sex. Okay? So as you can probably guess, positions that won't work are going to be ones that are rounded for people that are dealing with flexion tolerant pain, which is usually more disky type of stuff. It's not always, but it can be disky. And so for men and women, generally some type of quadruped position or doggy style is actually better. All right, and so you can totally see why men this will work better is because it's more here. All right, for women it's a little bit better because this is a position we call quadruped. We actually a lot of times teach exercises like a bird dog exercises for people who are dealing with flexion intolerant back pain, things like disc and so on, because this position is very tolerable. All right, now if there's a lot of this going on too, this changes the dynamics a little bit as well. And this is where people get a little bit confused. If they don't understand their tolerances, like if they're flexion or extension intolerant, then they might not understand what positions will work better for them. Now, you can obviously say doggy style is going to work better, but if this happened, then it'd be a little bit more challenging for the recipient, all right? Doggy style will generally work for someone standing here unless they're slumping over, right? So a more uprighted position is going to work a little bit better, okay? Now, using stuff like the spine and understanding what your spine is tolerant of is the first step, okay? These little things, like these little yellow things, like the nerves here, the little red thing, like in this case is a pretty large disc issue. All of these things are players in your back pain recovery. And so if you don't understand what's going on, you need to be tested, all right? Understanding what your spine is tolerant of will give you a lot of guidelines of what you can do over the next couple of weeks to settle the spine down and give you some empowerment too. As I mentioned in the beginning, it's a sad thing to see people's relationship have strain on it and it's in addition to them dealing with back pain as well. Back pain itself alone is a challenging thing to deal with, and so adding in the internal strain in the relationship is a little bit more challenging. But there's not a lot of reasons why you can't just get creative and talk to your partner about things like this, and just make sure that you guys are on the same page. All right, there's maybe desire, but then physical fear, and it's really common. So if you guys want more videos like this, subscribe to the channel. There's going to be other ones coming out. Obviously, we're going to try to keep it as PC as possible. It'd be really easy to make this pretty rank, but there's no need to do so. The first step, again, is getting evaluated. You need to be stress tested. MRIs and x-rays won't tell you what's going on and what your spine is tolerant of. You need to be load tested. You need to be stress tested. You need to make sure that someone's spending at least 20, 30 minutes with you figuring out what your spine likes and doesn't like. And a lot of times doing things like I mentioned before, like let's just say like the cat-cow, like that's good, ow, 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 right? And so doing exercises can help us figure out what's going on with you so we can guide you better of the positions that will work for you better, all right? Imagine it now, you can be having sex in the week. That'd be great, huh? So I'll see you guys next time. Subscribe and like the channel. Talk to you soon.